There is a question many men have wondered about, but very few feel comfortable asking out loud. Some notice differences over time. Others compare themselves to what they've seen or heard. And many quietly ask themselves, is what I'm experiencing normal? The topic is semen volume, and more specifically, the difference between what some casually refer to as shooters and dribblers. For some men, ejaculation appears forceful and abundant. For others, it feels weaker, slower, or less noticeable. This difference can create concern, confusion, and sometimes even a sense of lost masculinity. But what does science actually say? Before we go deeper into this conversation, take a moment right now to hit the like button. Comment below where you are watching from. And subscribe so you never miss medically grounded strategies that could help you protect your sexual health, confidence, and long-term vitality. Hello, gentlemen. I'm Dr. Hannah Cole. For over 2 decades, I have worked with men facing questions about fertility, ejaculation patterns, prostate health, erectile performance, and the natural changes that occur with age. One of the first things I explain to patients is this: ejaculation is not just a single event. It is a coordinated physiological process involving multiple organs. The testes produce sperm. The seminal vesicles contribute fluid that nourishes and transports sperm. The prostate adds additional secretions that influence consistency and movement. Finally, muscles in the pelvic floor contract rhythmically to expel the fluid outward. When all these systems work in harmony, ejaculation may appear strong and forceful. But when even one element is affected, whether by hydration, age, hormonal shifts, or lifestyle, the experience can change. Let us begin with volume itself. Average semen volume varies widely among men, but it typically falls within a modest range. What many men perceive as low is often still within normal physiological limits. However, noticeable decreases over time may reflect changes in fluid production or frequency patterns. One of the most common influences on volume is frequency of ejaculation. When ejaculation occurs very frequently, the body may not have enough time to fully replenish seminal fluid. This can lead to smaller volume and less forceful release. Conversely, spacing ejaculation allows for fuller buildup, which many men interpret as stronger output. Hydration plays a surprisingly important role. Seminal fluid is largely composed of water. Men who are dehydrated often experience reduced volume simply because the body prioritizes essential systems over reproductive fluid production. Increasing water intake can sometimes produce noticeable improvement. Hormonal balance is another key factor. Testosterone supports the function of reproductive organs and influences libido. While it does not directly determine volume alone, low levels may reduce overall sexual vitality, indirectly affecting ejaculation strength and frequency. Prostate health must also be considered. The prostate contributes significantly to seminal fluid. As men age, changes in prostate size or inflammation may influence both volume and force. This is one reason why ejaculation patterns sometimes shift after the age of 40 or 50. Pelvic muscle strength affects the shooting aspect. The force of ejaculation is largely driven by rhythmic contractions of pelvic floor muscles. When these muscles are strong and responsive, ejaculation may appear more forceful. When they are weak or fatigued, the release may feel slower or less projected. This is often misunderstood as a volume issue when it is actually a muscular one. Lifestyle habits create cumulative effects over time. Poor diet, excessive alcohol consumption, smoking, chronic stress, and lack of exercise can all impair circulation and hormonal balance. These factors reduce the efficiency of the reproductive system, leading to gradual changes that many men only notice later. Sleep quality also influences reproductive health. During deep sleep, the body regulates hormones and supports cellular repair. Chronic sleep deprivation can disrupt these processes, contributing to reduced vitality across multiple systems, including ejaculation patterns. Psychological state plays a role as well. Stress and anxiety activate the body's fight-or-flight response, which can interfere with the coordinated muscular contractions required for ejaculation. This may result in less forceful release or altered timing. It is also important to address perception versus reality. Many men compare themselves to exaggerated portrayals that do not reflect typical physiology. These comparisons can create unnecessary insecurity. In clinical practice, a wide range of ejaculation patterns are considered normal. The more important question is not whether someone is a shooter or a dribbler. The real question is whether the body is functioning comfortably, consistently, and without distress. There are, however, practical ways to support healthier function. Maintaining proper hydration ensures adequate fluid production. Allowing reasonable spacing between ejaculations can support volume. Engaging in regular physical activity improves circulation. Strengthening pelvic floor muscles enhances control and force. Managing stress and improving sleep quality support hormonal balance. When these foundations are in place, many men notice natural improvement without the need for extreme measures. It is also essential to recognize when medical evaluation is appropriate. Sudden drastic changes in volume, pain during ejaculation, blood and semen, or concerns about fertility should always be discussed with a qualified professional. Early assessment can identify underlying conditions before they progress. Ultimately, semen volume is only one aspect of male sexual health. Confidence, comfort, erectile function, and emotional connection all contribute to a fulfilling experience. Focusing exclusively on volume may overlook the broader picture of well-being. The goal is not to chase unrealistic standards. It is to understand your body and support it in a sustainable way. If today's discussion helped clarify this often misunderstood topic, make sure you subscribe for more medically grounded insights on prostate health, performance confidence, hormonal balance, and long-term vitality. And in our previous video, we explored what actually happens to your penis as you age, including the circulation and hormonal changes that directly influence erection quality and ejaculation patterns. Watching that next will give you a deeper understanding of the foundation behind everything we discussed today. Take a moment now and watch that video. Because when knowledge connects step by step, real confidence begins to build.